So good afternoon, everyone. I'm Lisa Silverman. I'm URAC's Client Education Specialist. Some of you know me from previous webinars. I'm here to help us get through the member service and communications focus area. We're going to go through the standards in that area of our Health Plan 8.1 accreditation. Next slide, please. So before we get started, feel free to message me with any tech issues. Also, we are a very small group today, so I'm actually going to allow people to talk. I'll ask you to talk. You'll be muted and you'll be able to unmute yourself. But because we're a small group today, it's really going to be beneficial. We can actually hear each other, which is a little strange, and this is a great thing for us. However, you are more than welcome to use the chat box for questions. Tell us things to say, slow down, speed up. Can you go back to that? We don't mind doing any of that. And where there are resources needed, we'll share some of those in the chat box. Next slide, please. Thank you. Donna, can you skip ahead to one more slide and we'll come back to this one? So real quick, before we get started, I want to introduce our team here. We've got Donna Merrick, who is the Product Enhancement Principal from URAC. She is the person over all things health plan, health network, Medicaid health plan, marketplace health plan, all of those things. She is the brains behind our accreditations. We've got Gosia Raczka, who is here. She is messaging from and on the call from Boston today, where she can do a validation review tomorrow. But we also have her here with us today. And in the chat box, you'll see Monica Dantzler-Thomas. She's our Director of Care Management here at URAC. Like I said, I'm Lisa Silverman. I'm URAC's Client Education Specialist. I saw a hand come up and I can allow people to talk. Let's go to our poll. Let me pull that up. So in this first poll here, we want to know on this scale here, how important are member support services to meeting your organization's goals? So answer the question for us. Let's see, there are 9 people on here. Let's see if we can get at least 5 to respond. Excellent. So, Donna, it looks like we've got out of our attendees here, most of them are saying that member support services are extremely important to their clients and to their organization's goals. One person says they're somewhat important. Nobody is saying they're not important. Anybody want to chime in on that in the chat? Tell us a little bit more how you how this plays out, or can we hear from you a little bit during the as Donna and Gosia go on? But anybody have anything they want to add right now? Okay, with that, I'm going to turn the floor over to, and I believe I'm turning it over to Donna to get us kicked off.
Thank you very much, Lisa. And the results of that poll are not unexpected. We heard during the advisory group meetings and meetings with our health standards committee who reviewed the health plan standards that the member services and communications area is extremely important to health plans. And so you can see that we pared it down to those things that are essential for those that are, that work in this area. This particular focus area is found in health plan, marketplace health plan, and Medicaid health plan. Gosia.
Donna, when you come back on, would you mind turning on your camera? And just so everybody knows, it's our style. Donna and Gosia know that I will interrupt them with your questions. I don't want you to feel lost 5 minutes in and have to wait 45 minutes to have us answer your question. And it also makes the webinar more engaging. So Donna and Gosia know that when I come back on camera, it's to ask a question from one of you or something that I think might come up. So feel free. We love those questions in the chat box, or raise your hand and I'll call on you.
Thank you, Lisa, for level setting. And so as we go into, we're going to talk about the standards for the member services and communications. And here are some of the standards. You'll see MSC1, which is related to rights and responsibilities, and then you have member communications. and so on. And as Donna just said, that there was this advisory group where they got input, and the focus areas were very concise and based on these standards to cover the aspects of member support that have the greatest impact on quality services and health outcomes. And so we're going to take a little bit of deeper dive as we go into the next slide about member rights and responsibilities, and are defined and enabled. And so before we kind of go in, I just kind of want to ask you guys a question that you can go ahead and respond in the chat. And that is, what percentage do you think health comes from our health behavior? So 20%, 40%, or 60%? I'll give everybody a second just to see what you think before I go into what it is.
And people should chat that into the chat box. Gosia, can you state that question one more time?
So what percentage of our health comes from health behaviors? 20%, 40%, or 60%? 60, Jennifer, thank you. Anyone else? Jamaica, 40%, thank you. Georgia, thank you, 40%. Cindy, 60. Thank you everyone for your responses. So recent estimates attribute 10 to 20% of health outcomes to be for medical care. So the correct answer in this situation would be 30 to 40% is to behavior. They've also found that 30% they attribute to genetics, and 10 to 20% for social and physical environment. So that's kind of really important, that we have the ability to drive health by people's health behaviors. So as we go into the next slide, so we're going to go ahead and talk about, when it comes to organizations, we're not prescriptive on how, what mechanisms you use to inform your members about their rights. I mean, there can be different mechanisms like print, digital, web-based, a member portal. So whichever one fits your organization, that's perfectly fine. And what do those member rights include? So URAC has researched the rights and responsibilities statements for over 10 health plans across the country that vary in sizes, small to large, and resulting analysis revealed common themes among them. And so when the advisory group reviewed, they reinforced that these are the most basic rights and responsibilities that an organization may state. We do understand that the organization might state them differently and have fewer categories. But as we go into that standard, these are some of the three. And as we go into the next slide, here are some other rights that we felt that it was very important. Again, the organization does not need to use the exact language that you'll find in the standards of these elements of performance for the member rights and responsibility literature, but just to kind of get an idea on what was found. And in addition to sharing how to submit a complaint and an appeal, member support may need to provide support in submitting a complaint and an appeal. So that's why we went ahead and put that in there. And then one of the themes that we really are kind of seeing, and a lot of organizations are seeing, is for the culturally and linguistic approved services. A plan can examine local and regional demographic data to ensure that staff are educated and trained on how to provide the cultural and linguistic appropriate services for the members, as well as to conduct a review of written and verbal communication to help assure that they reflect local needs.
Okay, Gosia.
And so, yes.
I'll wait for you to finish the slide, but then I'm going to chime in with a question for the group.
Okay, and there's great resources out there. If anybody needs any, just let us know. But that's something that is a lot of organizations are facing regarding the cultural and linguistic appropriateness of care. So I'll hand it over to you, Lisa.
So Gosia, you did such a great job engaging the group and asking their opinion. We're a small group again here. I'd love to hear what are some of these culturally and linguistically appropriate services that your organizations are providing. Gosia, maybe you have one that you've seen from somewhere along the road that you can start off with an example. But I'd love to hear is it large print? Is it what is the right thing? Is it materials in another language based on the community needs? And I'd love to hear in the chat or raise your hand and we'll call on you, or you can just talk, you can unmute yourself. But I'd love to hear some examples of what's actually happening in the field.
Yeah, and that's a great question. And one of the things, I don't know how many nurses we have on the call, but just tapping into the nurses' backgrounds is when people who are Jehovah Witnesses, so they can't get blood transfusion. So kind of knowing your population and being respectful and being able to help them regarding those kind of things. And so I'll wait for the chat to see if anybody has any other examples.
Anyone want to chime in with an example of something where you sort of got tripped up? Maybe because, I mean, this happens to all of us. Maybe it's like we weren't expecting that. We weren't expecting to suddenly have a patient who maybe had limited language, or who suddenly you realized, oh, the person had to bring a child to translate for them. Or I had to get on larger print is very important. Absolutely. Absolutely. Cultural training. Yep. Yeah, I've heard of some cases where, depending on cultures, it may be that only a female provider is able to, and vice versa, may treat female patients, or men may treat other men, where, you know, depending on the culture, the different genders don't mix. But also being conscious that gender may be fluid to some people, and just being aware of that language as well. Anything else anybody wants to add or chime in with the story on? Language lines. Yeah, language lines are huge. Yep. And I think, Gosia, some of this is also knowing your community and knowing where you are. I know my neighborhood happens to have a very large Haitian population. So a lot of our materials, but we also have a very large Salvadoran population. So I know our county and our health services puts out materials in Spanish and French. And they're looking at what are the next couple.
Very true, Lisa.
Thanks for my little interruption there. If anybody wants to chime in, please do in the chat.
And thank you, Monica, for putting that in the chat, that there are health agencies of healthcare research that do have culturally and linguistic appropriate services, so that all patients receive high quality care and achieve good health outcomes. So thank you for putting that resource.
Okay. All right, now let's move on to the other part of the equation here, member responsibilities. The first step for members to access health benefits is to get benefit information, learn how to use the benefits, and ask questions. So those are some of their responsibilities. It seems obvious, but important to point out to members. They need to supply the information to the organization needed to access the benefits and learn how to use them. Member rights and responsibilities help establish the relationship between a health plan and its members, where members must provide the information needed and work with the agreed upon plan, which may include things like getting lab work and other testing done as prescribed. It is understood that some members may not have the ability to fully understand their own health situation. And as such, family and/or caregivers may act as appropriate on behalf of the member. It is ultimately the responsibility of the health plan to communicate member rights and responsibilities. And we know that various programs like disease management and case management may have additional rights and responsibilities to communicate to members participating in those particular programs. And they would be complementary to those of the health plan. So on desktop review, organizations would upload in AccreditNet 3 documentation describing the mechanisms used to inform members of their rights and responsibilities. And again, note that URAC doesn't declare which ones you will use, and you may have multiple channels of communicating rights and responsibilities. We'd also like to see a sample copy of member rights and responsibilities uploaded for desktop review. Then for validation review, and here's where the rubber meets the road, URAC interviews with customer service representatives on distribution of member rights and responsibilities. So trust but verify. And so the VR, we will talk to and interview customer service representatives regarding sharing the information on rights and responsibilities. Now the next standard, MSC2, member communications. The organization identifies and communicates the information that members need to access their health benefits. Note that this is a mandatory standard, and all of the elements of performance that follow it are always applicable and must be met in order to achieve a full accreditation. This is in line with the scoring methodology that is applied to all of URAC's accreditation programs now and going forward. It's known as the 2-4-8 gatekeeper scoring methodology. So the health plan establishes the criteria for when members need to be updated on their health benefits. The plans should keep in mind that there may be state or federal rules defining those situations where members are to be updated on those benefits. And so on the desktop review, the health benefit communications plan is uploaded and shared. And then also you would provide an example of member communications covering health benefit updates. For this particular requirement, the validation compliance is verified on desktop review. Now, member services is expected to be able to provide plan coverage information on the first contact with the member. That will be one of the metrics we'll talk about a little bit later on during this webinar. Examples of member financial responsibilities include, but are not limited to, potential out-of-pocket costs, such as deductibles, co-pays, co-insurance, annual and lifetime co-insurance limits. The third element of performance that you see on the right side of the screen is the instance where members must be updated on changes to plan coverage as part of the communications plan. This will be prior to the end of the enrollment period, typically which occurs in 30 to 90 days. An example of relationships with other entities would include delegation of case management services to a contractor. This impacts the member by enabling the health plan to provide these specialized services for members with complex healthcare needs. Another example would be pharmacy benefits manager, designed to assist health plans to manage pharmacy benefits to meet member needs and manage costs to keep premiums down. Another example would be providing access to contracted network of providers to enhance member access to services. You'll see this sometimes in specialty networks such as chiropractic networks. So as you might have seen, and if you participated in our network management presentation, health plans measure the rate of member usage of providers within the network. In addition, knowing which services are provided out of network can inform future benefit coverage and decision plans. And I'll turn it over to Gosia.
Thanks, Donna. So to kind of take a deeper dive into the health benefits information, there are state and federal regulations that may prohibit members for requesting an override of certain types of coverages, exclusions. In these situations, organizations would have to share this information with the member. So like, for example, in New York, health plan members may not request an override of coverage exclusions for fertility treatment. So And that also, that goes into element G, which is if there's benefits caps, what to do if that cap is reached. So organizations will have to speak to that. And then in the next slide, in MSC3, optimizing a member's experience, organizations actively manage how members interact with them and receive health benefits. And then as we go into the next slide, so when it comes to MSC 3-1, where member services support, these are services that provide a support upon initial enrollment into the health plan and as needed thereafter. So if there is a disruption in health services as addressed in Network Management 5-2, disruptions in health services, these types of disruptions could include when a provider is no longer participating in the health plan or a health plan network. Or also another example would be when a member's benefits have been reached or exhausted and the plan's network management notifies the applicable departments of those changes to facilitate member outreach. And the other one is access to covered benefits, including here, as you see, whether it be emergency medications or other services. There might be others such as self-referrals to case management benefits. I want to take a really quick pause. Does anybody have any questions before we go into the next slide? Okay, so then we'll go in.
Hey, hold on. You can't get off that easily. Gosia, out of all that you just talked about, what do you want our attendees here to really take away from those last couple of slides or to not miss on our review? You're out in the field. Obviously, we see you from Boston today, even though home for you is totally different state. What are you hoping, or what's something you just talked about in the health benefits information, health benefit, optimizing the member experience? What mistake don't you want the people on today's call to make if they can listen to you? They can.
Sure. And Lisa, that's a great question. And one of the things that I really want to kind of speak to, and it's not only just to the slides that I reviewed, but your program guide is going to be your best friend because it has interpretive information. It also has information on what is expected for organizations to demonstrate desktop compliance. So that's that first part of and review an application submitted where you put in your documentation. So it really outlines what you have to provide as evidence that you're meeting the standard elements. And then it also gives you a section on how to prep and what will be expected or reviewed during a validation review. So there's those wonderful information in there that can kind of help guide through the different standards if you have any questions. And then I'm going to just do a little quick plug, Lisa, to the client portal, that if you do have any questions and you just need some clarification on some interpretation of the standards, you can definitely go to your client portal and submit that in there, and you'll have one of the reviewers review it and provide your response.
So let me catch up there for a second. We've got the client information hub, but we also have the standards interpretations portal. So I'm going to chat in the direct link to the client information hub, which has a ton of resources on it. And I'm going to chat in the link where you can submit questions about the standards. So give me just a second, Gosia, I'll let you keep going on.
Sure. Yeah, no, and while you're doing that, if you are currently working with a reviewer, then you really want to have those conversations with your reviewer. That place that you, and please, Monica and Lisa and Donna, keep me honest. Mm-hmm. But you want to submit those interpretive questions when you're not in the process of a application.
Absolutely, Gosia. And I can't stress this enough. Of 5 days before your application is due is not the time to submit an interpretive question. The best time to do it really is get the guide, you go through it with your team, you go through it again. We have so much information. That guide is really dense. but it's there for you. And ask those questions early on and tell your team a deadline of like a month out, because you want that time both to get the answer to the question, but also if you have to work on a policy or a procedure, if you have to update something, if somebody needs to be informed about something, you want to make sure you have enough time. Can't stress the importance enough of also being in touch with your client relations manager throughout the whole process. If there's something and you need an answer and you're not hearing, press on a little bit. We'll make sure that we get you the answer. But do that ahead of time. Your life will always be easier when you're working a couple weeks ahead of the deadline.
Agreed.
Yes. And if I could chime in here too a little bit, an ongoing theme with the member support services is accurate and up-to-date information available to those providing the member support services. And so as your staff would want to be able to speak to the ongoing education and training and meetings that occur, and we know occur in some of the best customer service departments, so that they're always kept up to date on the latest and know that updates have occurred and are occurring in support of the membership.
That's a great call out, Donna. Thank you.
Sure. Go ahead, Gosia.
All right. So benefit management requirements. So let's take a look a little bit about pharmacy. So there's requirements that include sharing the provisions of off-formulary prescribing, such as a member support service can assist the member with the process of requesting an exception for the formulary, where they were able to ask if a drug that is not on the formulary to be covered. So you want to make sure that you're providing this information for all areas, medical, behavioral health, and pharmacy. And so Donna, I will hand the next slide over to you.
All right. Thank you, Gosia. So member services has the most current member complaint and appeal processes available for immediate reference. Make sure that if there was a correction on the desktop review, that anything like that is communicated to your customer service reps and your system is updated, because you never know, the reviewer might ask that question when they come on and do the validation review. Member services accept complaints during initial contact. That's one of the metrics that we ask you to keep tabs on. And for appeals, the member follows the health plan's policy and processes, which may or may not include initiating an appeal through member support services. But again, they would have the most up-to-date process to share with the member and help them move along and getting started with that. So obtaining health information is critical. And one of the things that an organization will want to do is to provide evidence-based health information for common conditions and diagnoses, and that would include diagnostics and treatment. So for desktop review, you want to include documents addressing the information and assistance provided to members. And you'll see this theme with other standard elements of performance. So again, be sure to review the program guide to ensure you have submitted documentation that meets the intent of these elements of performance. And as with a couple of the sections here that we're presenting today, this particular set of requirements is met on the desktop review. So now we have a poll question. That says, do you have member support staff dedicated to or specializing in providing support for members receiving case management services?
Okay, I see we have 2 respondents in there, but I know I have 9 of you on the call. The answer may be that you're not sure, and that's totally fine. That's why we put it in there. We realize everybody can't know everything about what's happening at an organization, especially if you're with a larger place. 5, 6. Come on. Okay, Donna, we got 2/3 of the group participating, and they all said yes.
Wow, that's exciting, because our research has found that that is a best practice. And you'll see that as one of the elements of performance in the population health management section of the health plan standards. So again, being able to provide the that special support and direct those members who are receiving case management services can be critical in assisting with their plan of care. Wow, that's good to see everyone moving in that direction, because that has been well supported by the documentation. Anyone have any other thoughts or comments on that that you'd like to share in the chat? How has your experience been with that? Have members been giving you good feedback on that practice?
And Donna, we have the phone lines open
Oh,
if anybody
great.
wants to chime in, because we are a smaller group. What has been the feedback on this? Has you heard anything good? Have you heard anything bad? Or you do have data to show it?
We had the research that we did showed that this practice is considered a best practice. And again, to facilitate that communication and make sure that there are individuals in the support services providing support services to members that know where to direct them and do so quickly and directly to even their specific case manager as needed.
And I want to just call out, we realize people working on accreditation may not have seen the actual benefits of this. It may be a policy that gets into an accreditation packet, recognizing that, again, similar to you can't know all, it's also that you can't be all to everyone.
Yeah. Okay, we'll go ahead and on. So member agency over their plan of care continues to be a plan goal. So standard MSC4 calls for the organization assures that members have the ability to access support services and provide input on services. So accessing member support services includes special assistance for those whom English is not their primary language, and with those who have special needs, such as cognitive or physical impairments. And we talked a little bit about that earlier, kind of alluded to that. And so having those language lines and being able to assist people with hearing issues or other issues is important to make sure they can tap into their benefits as they need to. Customer service representatives should have access to records of members' previous interactions with the organization as they provide one-on-one support with the member. And so one of the things we like to call out is, does each member have a unique ID number? Does this number follow them regardless of plan coverage? These are some of the strategies we've seen health plans employ over the years to be able to have information at their fingertips to assist members as they call in. And I see Cindy has written a comment to everyone. Our support services for case management and disease management provides specialized assistance and connects members to those services to a CM or DM nurse. They understand the case management and disease management processes and are better able to address the issues. That's great. Thank you. Thank you, Cindy, for sharing that. That has been the experience that we've heard shared from others. So initial contact with member support services. These are the types of calls that are included in the quote, first call resolution rate that would be analyzed and reported to the requisite quality oversight body for your health plan. So indeed, when a member calls in, the member support services would be able to address these items right off the bat: benefits verification and eligibility, participating provider selection, answer claims questions, and the acceptance of complaints.
Donna, I sit on the marketing team. This is natural for me, but for those of you who do have large call centers, URAC also offers a health call center and a health contact center accreditation. A lot of the standards go between them. So what you might use to apply for health plan news documents, the organizational structures, things like that may also apply to those accreditations. I'm going to just chat in the links to those, but I didn't want to be remiss and not mention that we have them. So we realize our current clients may not even know that, hey, all you have to do is add this on. It's not that much more work, and we can get you in the same cycle.
Absolutely. Thank you, Lisa. And as you can see on the screen there, members and their healthcare practitioners have 20 hours per day, 7 days per week access to support through various media. And this was met with a little bit of pushback, as you might imagine. We are in a 24/7 world, and yet providing that excellent customer service, which I know you and your departments are used to giving, can be a challenge over 24/7 time frame. So we introduced this element of performance as a leading indicator for that reason. And that's why we have a lot of pairs of eyes and different levels of review of the standards before they're released. So as a leading indicator, you may determine that this element is not applicable if you choose not to meet it. And if that is the case, then you would mark the standard element as not applicable and upload a document with a statement to that effect. So again, various media can be used to meet this leading indicator. It may be that after normal business hours, there is asynchronous communication that is available online through email or web-based informative chats and things like that.
Thank you, Donna. So that moves us into member input and surveys. And as an organization, you can go ahead and collect that information however you see fit. Sometimes, whether it be focus groups or surveys or from your complaints and grievances, that's purely up to you. And in the next slide, we're going to talk about as URAC, we go ahead and we recognize the CAP survey, which is the Consumer Assessment of Health Care Providers and Systems, which is a standardized service to go ahead and collect experience and care ratings information from members. So your organization can go ahead and use that one. And schedule for member surveys. You as the plan establishes a schedule for ongoing surveys for members. And as you can kind of read through the slide, it kind of shows you the different kind. You as the organization will determine the mechanisms, like I said earlier, on how you collect that, as we're not prescriptive. One of the things that the URAC board did weigh in on the member survey requirements and acknowledged that it is hard to do. Like, we get it. It's really hard to kind of get people to engage and provide you that insight. And response rates may not be where you would like them to be, but that the member behavior impacts the care as much as 30 to 40%, as we spoke earlier in one of the slides. So as we mentioned earlier, it becomes very important to get their perspectives to kind of see there's different opportunities to mitigate those gaps in health that they might be experienced through these surveys. And with this standard, to demonstrate desktop compliance, you would be submitting policies and procedures addressing member input and surveys, the schedule of those surveys, as well as the results. And one of the things that I do like to kind of call out is in some of these standards, you'll see that there's nothing to be done on the validation, and this is one of them because your compliance is only demonstrated on the desktop review. And then so that takes us to a chat poll question. I'll hand it over to you, Lisa.
So we know survey fatigue is a real thing. I feel like every time I want to chat with somebody online, I mean, I just talked with Verizon and I had one simple question. They're like, will you answer these 5 questions? I was like, you answered one of mine, right? So we know that people are surveyed out. So how does your organization, you can chat this in, you can raise your hand to talk about this. How do you balance the need for member survey data insights while really being mindful of member survey fatigue? Because if there's somebody out in the world who's not survey fatigued, I'd love to meet them and just learn how they did it. So what are you doing? Is it that you do a short and sweet survey? Is it that it's only once a year? Is it that it's only after an interaction and it's not continuous? How are you doing this? And again, the phone lines are open, so just raise your hand and you can talk. Anybody? Anybody? Gosia,
So I know, like,
yeah, I'm gonna pull you back in.
yeah. So I know, like, I've in previous organizations that I've worked with, one of the things that they found very successful, instead of mailing out a survey, they would actually have them transferred to another person that would ask them the questions, because they noticed that when it was an automated survey, then people would hang up, but they would ask, or even whoever they would be talking to, whether it be in claims or benefits, that, you know, they would ask questions like, well, did you feel my assistance was helpful? You know, is there anything that I can do better? And they would capture that information in that sense, because they've already engaged to the person, they've already spoken. So that's what they've seen as very successful.
Anybody else doing that? Anyone else doing that at your plans? This is apparently a group that loves polls and doesn't mind answering our polls. And maybe that's a good thing to take away from this conversation here. I think the next slide is back to Donna.
Yeah.
Shamika, thank you. And she said, when I'm asked to take a survey, if I want to take a quick survey, I may say yes. And then if too long, I hang up. Yeah, no, I mean,
Yeah.
Shamika,
Yeah.
you're not the only person on this call who has done that, raises her hand right here to speak from experience. Like, how much of my time do you get? I mean, I do teaching and training. This is my bread and butter right here. And my thought is, if I have you for an hour, I get 1 minute of your time to answer a survey, which is going to pop up at the end of your screen. If I have you for a day, I get about 5 to 10 minutes of your time to answer a survey. If I have you for a week, you can bet I'm asking for a good 20 minutes because I want a lot. There's a lot I put into that. But how do you balance? Like, do other people have those guys? If I ask you one question, you can bet I'm not going to want to respond with 5 questions.
And you could
Agreed.
also do permission marketing. You can ask those first 1 or 2 questions and then ask, would you, we have some additional follow-on questions if you have the time.
Yeah. You
And
know,
you
there's some
can-
great retailers that do that will give me the, how was your experience in the one email? And then when I click that, I answer that one question, and they say, are you willing to answer some more? And depending on the day.
Yeah. And the situation, sure. Lots of ways to do that. And also still, you know, having the group feedback sessions and professionals to do that for you. So there's all kinds of ways to do it, and be creative. We know, again, we acknowledge that it's a challenge to secure that member input, and and therefore you still see it in the standards, and wish the best for you and your departments to glean what you can from that very valuable information. So the next set of elements of performance, MSC 4-3, analysis and reporting on member communications. So the plan would report analysis of the data collected, including any improvement activities, to its quality management committee or other quality oversight body. Member survey data and feedback includes examining the survey response rate and the accuracy of data shared through member support services. And then, of course, we talked about those items for that first call resolution rate. The feedback that URAC received during the advisory group meetings indicated that these were all basics to being able to ensure high quality, you know, member support services in an ongoing fashion for members. So what will you do with the data? I'm going to point you to foundational focus areas, performance monitoring and improvement, PMI 1-1, quality structure. You identify the metrics and the quantifiable goals relevant to the program, and you set the bar for performance. That's one of the things we've employed throughout the various sections in the health plan accreditation, in that we heard you that there is some data that's basic to any function that you might want to measure your performance, but you set that performance bar. And that might be impacted by contracts that you have with your clients. So you'll want to maintain a quality oversight body that is responsible for monitoring the metrics and progress in meeting those quantifiable goals and overseeing any improvement activities. So and then we have PMI 2-1, data collection and evaluation. To close the loop here, you collect accurate data for each metric, monitor your progress towards your quantifiable goals that you selected, and don't forget that you need to conduct an analysis of the data. We have applicant organizations, as Gosia has shared with us in the past, that do a fantastic job collecting the data, and then we don't see the analysis. So you want to make sure that someone who's understanding of the functions, that's where you're looking at the performance, can take a look at that data and help you crunch it and get it down to usable data that's actionable, where you can tell, are you meeting your performance metrics? So then you want to identify any performance trends at a minimum, take a look at this data annually, and then implement improvement activities. So again, that takes that quality process, to its conclusion, and there's hopefully plenty of data for the member support services area. Gosia, did you have anything
Cindy,
to add
I see
there?
your question. Yeah, thank you, Donna. So I see that Cindy put a question for us. From our experience, what areas of the health plan takes on the survey and analysis responsibility? So that's a great question, Cindy. And, every health plan is a little bit different, but usually each focus area within the health plan accreditation should take onus of their own surveys, as they know what services they provide, and do that analysis. And then what you can do is pull all of that information together and look at it as a whole from a health plan perspective. Donna, Monica, do you guys have any other ways that you've seen it done?
Well, the standards continue to point to that quality management oversight body and that ongoing communication between the department, in this case, member services, and that quality management oversight body. And so as part of that annual plan, you talk about goals and the resources needed to reach those goals. And so securing the resources as part of your annual planning within your department and with other departments within the health plan can be part of that overall strategy to ensure that you can secure the funding and the requisite experience and expertise to help you, reach your performance goals and know that you've reached them and collect that data overall. So
thank you, Donna. We hope that we answered your question, Cindy. If we didn't, please let us know.
yes.
Donna, do you want to move to the next slide, and I'll do a little bit of plug for some upcoming events?
Sure. I did want to point out one thing though. First though, Monica has a comment to everyone here that the Quality Management Committee is sometimes referred to as the Quality Management Oversight Committee. Thank you, Monica. Yes, URAC is not prescriptive on how you name that Quality Management Oversight body. And, there will be different ways of relationships set up and naming of those committees that are pertinent to the member support services.
So this is me from your friendly client education team over here. I'm going to plug things on the right first because they're most important. We have URAC Connect coming up. You probably have gotten a bunch of emails from us about it. We would love to see you in Washington, D.C. at the end of October. We're going to go through updated standards. Monica and her team will be on hand to answer questions. There'll be some breakout time where you'll be able to talk about health plans and the like. We're going to go through the updated foundational focus areas. If you're applying for this accreditation, you're going to be under our new foundational focus areas. So should be good to go. It's going to be a great time to meet, to network with other healthcare professionals. Is anybody coming? If you are, I'd love to just know. I know the registration. I don't know it inside and out, but I manage it. So chime in if you're coming. If you have questions, now's a great time to ask. We also have 2 other trainings coming up. One is a refresher on how to write policies and procedures. We're hosting that next Wednesday at the time we have up there. I'm going to confirm. I believe it's actually not on there. So that's next Wednesday at 1 o'clock. And then we'll do our credentialing webinar in this series for next Friday. And then we do a monthly AccreditNet training the second Wednesday of every month. And that's hugely popular. It's run by our Chief Information Officer. She goes through everything you need to know on AccreditNet. So I hope you'll get on there. You can register for any of those trainings on clients.urac.org. And I'm going to chat in the link to URAC Connect. Is anybody coming to URAC Connect? Is anybody thinking about it? We'd love to get you in at this low rate. The rate is $899. It does go up on Monday to $975. So if you're thinking about it, this is the week to register. This is also the week to book your hotel. The hotel rate is currently $279 a night. Once we close the room block on Monday, I saw the hotel rates are closer to about $400 a night, and $279 a night in Washington, D.C. in October is pretty darn good.
Yes.
Indeed it is.
Mm-hmm. Yeah, URAC Connect will be a good opportunity for people to meet with some members of the URAC executive team, the reviewers and others. It's a great way to network with others in your industry as well.
Any final questions from the group? I hope we've answered your questions along the way. You've got the information you need. We'll have this recording up on the Client Information Hub by the end of the week. And then probably around October 10th or October 12th, you'll receive an email from us with links to all of the webinars in this series. But they are up on the Client Information Hub. We get them up there a couple of days after the event. So thank you so much to everyone who joined for chiming in. It was great to chat with you, and I hope to see some of you on a future webinar or in October in person. This officially concludes the webinar.